as we enter this phase of living with the virus and moving towards it becoming endemic, as it has already been declared in some other countries which were ravaged by their population, we have taken the following decisions going forward. The retention of masking. Appropriate mask wearing is an essential public health measure which should be retained at this time, especially due to the circulation of the extremely infectious Omicron variant, which lends itself to aerosolization and to significantly asymptomatic and mildly symptomatic disease. In late December 2021, the WHO re-emphasized its recommendation to maintain mask use in the face of Omicron. As such, mask use will remain in force at this time in all public spaces and places where there is public interaction. Public transport will be allowed to return to 100% of capacity. Mask wearing will continue to be required in vehicles being used for public transport, including all vehicles in which persons are paying to be transported. Families will no longer be required to be masked in their vehicles. This change will also apply to marine vessels being used by families. We are removing restrictions with respect to the length of time and numerical capacity at religious places of worship. Mask wearing will continue to be required during services at religious places of worship. The number of persons permitted at graveside funeral services will be unrestricted, but mask wearing is mandatory for the time being. For unvaccinated nationals returning to Trinidad and Tobago, a reduction in the quarantine time would be applicable. Quarantine time will be reduced from 14 days to 7 days, with discharge taking place on the receipt of a negative PCR test on the 7th day. Madam Speaker, we will decrease the national quarantine time for contacts of positive cases from 14 days to 10 days. This would allow for increased productivity and a decrease in the likelihood of staffing shortages, especially amongst the essential services. Of note, the Ministry of Health recently reduced the isolation time for positive patients from 21 days in all categories to 10 days for persons with no symptoms and 13 days for those with moderate to severe disease. They will be discharged in accordance with the discretion of the county medical officers of health. Public gatherings of persons in groups of no more than 25 is now to be permissible. The recommencement of team sports and contact sports is allowed. We will allow the establishment that are currently allowed to operate as safe zones for vaccinated or exempted persons and children under the age of 12 to operate at 75% capacity. Provided that we do not have dangerous changes in the COVID-19 position, we will permit all children to return to physical schooling in term 3. The Ministry of Education will continue to put out the necessary guidelines to safely manage this process. As of Monday, 7th March 2022, the public service will return to full service and all public servants will be expected to return to work as normal. Additionally, Madam Speaker, the Ministry of Health will be presenting a national pathway for the consolidation of the public health service that will see the return to the health system and by extension health services to an as near normal existence as the country transitions from the acute phase to the endemic phase of COVID-19. A structured, risk-based approach will be adopted to gradually reduce the footprint of the parallel healthcare system and regularizing the hospital system. The proposal will be implemented on a phased basis based on real-time risk assessment starting with point 14. The Minister will give further details next week. Madam Speaker, these initiatives will move us closer to the resumption of normal life and will be implemented via the public health regulations where appropriate, starting with those instructions coming from Monday of the week ahead. We continue to navigate the pandemic, and I trust that we will act responsibly and hopefully head towards COVID-19 becoming endemic in a population that has developed good immunity levels of protection naturally or vaccine-induced. Madam Speaker, the now known and experienced characteristics of the Omicron virus allow us to make these decisions, but make no mistake about it. Even as we react to an almost endemic condition, it is possible that a dangerous new variant could appear, resulting in a swift review of these decisions because we are still in a pandemic. We look forward to being able to confidently join others who have already declared the virus endemic, but we must remain cautious as we move towards such time. Let us continue to be responsible. And Madam Speaker, may God continue to bless Trinidad and Tobago.
Member for Old East.
Thank you very much, Madam Speaker. Pursuant to Standing Order 24.4, Honourable Prime Minister, in light of the statement made, could you indicate at this time whether the government has indeed climbed down on its position of mandatory vaccination in the public service?
Madam Speaker, that will be caught up in what I said. When I said that given the surprisingly good result and the behavior of Omicron, that we have placed hold on drastic actions because the circumstances have changed drastically between mid-December and March.